On the campaign trail, President-elect Donald Trump repeatedly spoke about the importance of veterans' health care. And now the Trump administration will have to work with the House and Senate to follow through on these promises. One America's John Hines reports from Washington.
Veterans health care is high on President-elect Trump's agenda, and he's already started reaching out to the Veterans Affairs committees in the Congress, says Senate Veterans Affairs Committee Chairman Johnny Isakson.
President-elect Trump has put his actions exactly where his speeches were. He has got his transition staff working with us now, understanding where we are with veterans improvements and where we want to go together. He's very interested in making sure we fulfill our promise to our veterans that we gave to them when they were recruited or when they decided to volunteer for the military. I think it's one of his top priorities, and I think you'll see that bear out early in the presidency.
And part of that promise may involve offering health care to veterans more often in private health care facilities, says Isakson.
Giving veterans some access to private health care when they couldn't get the health care they needed from the VA. I think that has to be expanded and improved. The more money we stop putting into bricks and mortar in the VA and we start putting into benefits to the veterans for health care services that are available at other places, the better we can maximize the investment in veterans health care for the veteran and for the United States government. So we're going to work very closely with the President-elect Trump on that issue.
Expanding and improving veterans' health care is the goal, of course, but how President Trump plans to do that may depend on his choice for VA Secretary. And there appear to be three frontrunners, says John O'Shea of the Heritage Foundation.
The serious ones, I think, are Jeff Miller, who certainly has had a lot of experience, at least in terms of policy on VA issues in the House. Senator Scott Brown, who's also had at least committee experience in terms of VA issues. And then I think the other person would be Pete Hegseth, who was former CEO with Concerned Veterans for America.
O'Shea says whoever Trump chooses, the president-elect is likely to continue to place a high priority on veterans' health care issues. John Hines, One America News, Washington.